Living with overactive bladder was very tough for me. I was so embarrassed and afraid. Chesapeake Urology turned everything around for me.
I've never been to a urologist before and I didn't know what to expect. We mapped out my treatment. It's been working great.
My name is Dr. Lisa Hawes and I specialize in treating women with overactive bladder. Overactive bladder is a chronic condition. There is no cure, but there is management of the symptoms. The bladder has two functions. The first function is to store urine. The second function is to empty the urine. What happens in overactive bladder is one of these functions isn't quite as effective. The first step in evaluation will be a bladder diary. I'm going to ask you to record not only how much you drink during the day, but what you drink. Keep a record of how often you go to the bathroom, whether you have urgency, and whether you leak before you get to the bathroom. I will then evaluate this to determine if we can find any obvious causes, such as dietary triggers or behavior issues. If at this point it's not exactly clear what's going on, we'll plan urodynamics.
My name is Betty Hall, and I'm a urodynamicist. Urodynamics is a bladder function test and tells us how the bladder fills, stores, and empties. We do urodynamics before moving on to another therapy to make sure that overactive bladder is the patient's only issue.
My name's Sandra Barker. I'm a women's health nurse practitioner who specializes in urogynecology. One of the treatment options that your physician might include is physical therapy. Some of the things that you'll do at pelvic floor physical therapy are bladder training, delayed or timed voiding, pelvic floor physical therapy exercises, and behavior modification. Lifestyle modifications are also important in helping you to control your bladder symptoms. This includes your fluids intake, dietary irritants that we need to avoid, and also keeping a bladder diary. If these lifestyle modifications, physical therapy, and first-line therapies are not working for you, we do have additional therapies that we can continue on with.
There are two types of medications to help manage overactive bladder. The first is an anticholinergic, which helps inhibit bladder squeeze, which is what gives you the urgency and then the leakage. The second is called a beta-3 agonist. This drug helps facilitate storage so that you can hold more before you feel the need to go. If diet changes, behavior modifications, and medications still haven't controlled your symptoms to your satisfaction, we will consider advanced therapies. In peripheral tibial nerve stimulation, we place a small acupuncture-sized needle into the tibial nerve, which runs just behind the ankle. We send a small impulse up the nerve. Over time, this will help calm the bladder and improve your frequency, urgency, and urge leakage. This is a gradual treatment. You come once a week for 12 weeks to the office for the procedure. By the end of the treatment, your frequency and urgency should be well under control. Botox is a muscle paralytic that we inject just underneath the lining of the bladder. The procedure takes approximately 10 minutes and can be done in the office. After this, you're free to go home and there's no activity restrictions. Sometimes, overactive bladder is not a muscle problem, it's a nerve problem. We can address this by a treatment called InterStim. We decide to test the nerves to see if we can calm them down and stop the nerves from sending this overactive signal to the bladder. This can be done by taking a small wire the size of a hair and placing it next to the two nerves that go to the bladder. We set these small wires up to a little impulse generator. If the problem is truly a nerve problem, you'll see improvement in your symptoms almost immediately. If your improvement is at least 50%, we can put a slightly larger wire next to the nerve that goes to the bladder and hook this up to a small battery. Through this battery, we can control the wire and the stimulation so that your frequency and urgency are well controlled.
I'm Sue Spurlock. I'm a patient navigator. The patient navigator will meet the patient with their initial diagnosis and hold their hand through their OAB journey. The patient can communicate with me. I can be the link between them and the physician.
Overactive bladder may be common, but it's not normal, and there are things we can do about it. Our goal is to get you back to the life you want to live, and we can do that.
It'll just turn your whole life around. My kids are happy to have me back. They have their mommy back. They're just so happy, and that makes me happy.
I made an appointment at Chesapeake, and it changed my life. It's the best decision I ever made.